Meanwhile, India's struggle with its COVID-19 outbreak, leading it to restrict exports of its jabs, is having repercussions on the global vaccination effort. And nowhere is that more evident than on the African continent. Most countries there have already received vaccines via the COVAX program, which is working to provide free vaccines to poorer countries. But the deliveries have been small relative to population size, and only about 2% of the world's vaccines so far have been administered on the African continent.
This classroom in the capital of Madagascar has been turned into a COVID-19 ward. In recent weeks, the island nation's been hit by a second wave of infections. New confirmed cases have averaged around double the number during the first peak last year. The country's health minister attributed the surge to a more aggressive variant first detected in South Africa, and he announced a health policy U-turn. We had discussions with our scientists and decided to go for vaccinations as another way to protect the population. We are now working on this with the COVAX initiative. The decision represents a change of mind by Madagascar's president, who initially refused to participate in the COVAX programme. He instead promoted a scientifically unproven remedy marketed as COVID organics. I am convinced, I am persuaded that history will prove us right. There are already 2 cases that have been cured with COVID organics, but we will see what happens next. The World Health Organization warned against its use before it had undergone proper scientific trials. And 1 year on, no clinical data has been made publicly available to support the president's claims that the plant-based treatment can prevent and cure COVID-19. It is now sold in drink and capsule form and has been widely distributed in Madagascar and also exported abroad. When the vaccines arrive, Madagascar plans to offer the first doses to health workers. It will be one of the last countries in Africa to launch a coronavirus inoculation campaign.